Lyme has affected my life in every single way that it could and can. It really has an impact not only on your present, but on the type of future that you want to build and hope to build.
Lyme is a bacterial infection transmitted mainly by ticks. The bigger question is probably the aspects of my life that it hasn't affected.
Yeah, my family's been farming for, I guess, probably 80 years or more in that neck of the woods. I know I used to have so many ticks on me that you just, oh, got another one, and you just crush them in your fingers, throw them to the side there. Then, funny, the first thing they ask you is, do you remember the tick? I was like, well, which one?
You don't feel a tick. It's on you. It goes to the warm spots, the armpits, the hair, the ears, belly buttons, groin, knees, and you don't really feel it.
I grew up on Long Point, and ticks were already a problem there even back in the 70s. Ticks were more prevalent and more highly infected than we realized. So I think that what we saw for a long time was just the tip of the iceberg. Clinically, we started seeing cases of Lyme disease, established Lyme disease, about 15 years ago. So the real tragedy is that for several decades, there were a lot of people who did have Lyme disease and didn't get treatment for it.
I was in physiotherapy, heavy physiotherapy for 18 months and barely able to move. My joints, I looked like I was 90 years old, barely able to walk. Doctors will say, well, it wasn't on you 24 or 36 hours. The tick on me was on me for 2 hours.
My symptoms, within 6 hours, I felt like I had a terrible, terrible flu. Everything ached, I had a headache, I didn't feel right in any way. It was getting to the point where walking, I actually had to tell my legs to move forward. And the pain in my feet was absolutely horrific, to the point where I'd clenched my teeth so badly, I cracked a molar that had to be pulled.
I went from kind of being a super active, engaged academic and athlete to somebody that couldn't walk 20 steps to the kitchen. Severe neurological issues, insomnia, headaches that never ever went away, completely debilitating, intolerance to reading, computer screens, music, being in the room with more than one person, basically just kind of going further and further downhill until I couldn't function, and it was hardly bearable to be alive.
Sometimes you need help getting up out of the chair, climb stairs like a dog. If you fall on the ground, you gotta crawl over to like a car tire and try to pry yourself up off the ground. My son has to push me up the ladder into the tractor and stuff like that. I can't carry anything. Like, your body's just slowly falling apart pretty much is what it is. So
When you are dealing with levels of pain to the point that you just disassociate, levels of physical pain, but that does something mentally and emotionally to you and to how you see yourself.
the family, they rally up and help you, and they have to do everything for you, so you feel like you're an inconvenience and stuff like that at times. But they say get rid of your stress. Well, how can you get rid of stress when your whole life is stress?
Mentally, the brain fog, and just the losing confidence in yourself. And as a practitioner, I'm thinking, if I can't even help myself, how am I supposed to help other people?
One of the real tragedies with Lyme is the number of people who were infected suffered disabling chronic illnesses and never really got an accurate diagnosis. Often they were bumped from one specialty to another, and one of the problems is they couldn't document what was wrong with them.
I was to 10 different doctors, infectious disease, rheumatologists, you name it, I saw them. And nobody could nail it down or give me an answer.
I was being bounced between doctor after doctor, and nobody had an answer that made sense to me. They would put me on some drug, and then I'd go back and say, I'm not getting better, and they'd say, okay, it was probably the drug, we'll put you on this one to make you better. And I would say, come back, I'm getting worse, it's getting worse.
If I'd have got treated early on, I think this would have been corrected at least not as bad as what it is.
There is a lot of confusion, a lot of misinformation, so I just really encourage people to find other support people that are knowledgeable and definitely get treated a lot earlier than I did.
Once you remove the tick, if there's redness, there's itching, swelling at the site, you should assume that you've been injected with potentially infectious material, and at that point you should be seeking attention from a doctor to obtain a preventative antibiotic dose. The other really important tool is the emergence of companies like Geneticks, who are able to accurately and quickly test ticks in a way that allows people to understand what their risks are.
There's a great lab where you can get it tested in Canada at Geneticks, and I'm glad that there is an opportunity like that available, because when I was sick, there wasn't.
I am the CEO and founder of Geneticks, which is a tick testing company. Doctors will, for the most part, honor our reports and the assessments we've made. We don't really have a hand in what treatment happens after that, but they do often honor the reports that we send them. I think if somebody came to me saying they suspected they had Lyme disease, my advice for them would be to find a physician that is knowledgeable and experienced with Lyme disease, and then they can help navigate, first of all, determining if the symptoms are caused by Lyme disease or tick-borne diseases at all, and then what to do if they are and how to appropriately treat for that so you can get better and don't get sort of stuck in this world of chronic illness.
If you remove it carefully, if the tick hasn't had an opportunity to embed its mouth parts and inject the infectious material, then you're probably okay to forego treatment. But as soon as you start seeing redness and swelling and a reaction at the site, you have to assume that the bite needs to be treated.
Anytime I find a tick, I Ziploc it and I put it in the freezer and I mark it. If I start getting sick or show a rash, then I'm going to get it tested. You have to be your own health advocate.
Believe that you can get better.
It can be managed, you can have your life back, but you have to learn to live differently sometimes.
You have to understand that your body, your mental, the physical, the emotional, that is always going to come first.
Get checked out, that's the biggest thing, because you don't want to end up like this.